Assalamu alaikum and welcome back to another episode of What's Up Doc. I'm your host, Dr. Aalia Al-Barwani, and I'm a board certified physician. My show, What's Up Doc, is a production of Muslim Network TV, the only Muslim focused network broadcasting in North America. You can watch all of our shows streaming on Roku TV, Fire TV, Apple TV, and Galaxy 19, and you can watch us nearly every day on our website at muslimnetwork.tv and on our YouTube page at youtube.com/Muslim Network TV. Today we have a really interesting episode, and I say that about a lot of episodes, but I really mean it with this one. Today we're talking about something that has affected all of us around the world in one way or another, and that is COVID-19. At the latest count, sources state that roughly 4.5 million people have died from this deadly pandemic. A lot has changed in what we have learned about COVID in the past year, and a lot has changed from our last episode on this topic with our guest for today, our returning guest, I should say, Dr. Aadia Rana. Dr. Rana is an associate professor of medicine in the Division of Infectious Diseases at the University of Alabama, Birmingham, and an associate scientist with the UAB Center for AIDS Research. She received her medical degree from the University of Alabama, Birmingham, and completed her internal medicine residency at Case Western Reserve University in Cleveland, Ohio. She also completed a fellowship in infectious diseases at Brown University in Providence, Rhode Island. She's part of UAB's COVID-19 response team and serves on UAB's COVID-19 treatment guidelines and COVID clinical trials committee. Welcome, Dr. Rana. Welcome back, I should say.
Thank you. Assalamu alaikum. It's wonderful to be back and share with you all the updates that we have with regards to this pandemic.
Really appreciate it. I know you're deep in the trenches. We were chatting just before we started broadcasting how busy you are and how much has changed since the last time we spoke. And I'd like us to get stuck right in the middle with giving us an update on just what the current status is. There's a lot of, almost on a weekly basis, that we're being bombarded with new things that are happening and changing with this pandemic. So let's get started with the biggest thing that we've learned about, which it has been plaguing and has kind of spearheaded this fourth wave with the Delta variant.
Yeah, no, absolutely. So we spoke in January. At that time, we had the beginning of the vaccinations, but we were also in what was at that time called the third wave of the pandemic. So we were having spikes in cases here in the United States, so really around the holidays or related to travel during the holidays, both Thanksgiving as well as the Christmas and New Year's holidays. And those were reflected in January and February with our peaks in our cases. At the same time, we were starting to our vaccination program. So the massive campaign to develop and test these vaccines had resulted in, I think, the first doses starting towards the end of December and just in January. But when we spoke, still very limited to specific healthcare personnel or the elderly population. So now here we are in August with a wide availability, of course, of the vaccines here in the United States, but yet still a escalating pandemic in terms of number of cases throughout the entire country. And so there is a new variant, the Delta variant, that all viruses mutate, usually as they transmit from person to person. They can change, and especially if they have a lot of opportunity to transmit to different people or to different organisms, they can certainly mutate. And we think that's what's happened in this case. And so what we've learned about the Delta variant compared to the original virus and even some of the earlier variants that we saw is a much higher transmissibility. So the number that gets quoted is 200% more transmissible than our original COVID-19 strains that we saw with the third wave. So as you can imagine, it's been a little bit of a perfect storm where we have this much higher transmissible virus at the same time, where a lot of the restrictions that had been in place when we were even experiencing our third wave, whether it was with regards to mask mandates or people not meeting in person or schools being closed or what have you. And as these things opened up, and then we have this very transmissible virus, we're seeing a lot more cases. The thing that I will point out that's also different is, of course, is more people are vaccinated than they were in January. The challenge is that not as many people are vaccinated as probably need to be in order to prevent the virus from spreading from person to person, what we would consider herd immunity. We probably need about 80 to 90% of people to have sustained antibodies or have responses in their body, so that whether it's from the vaccine or people who've been exposed to the virus, in order to sort of put a halt to that. And in the state that I live in Alabama, and we have yet to achieve even 40% of our population becoming vaccinated. So still quite a ways bit to go. And as you alluded to in our prior conversation, I have just recently completed hospital service, and I know that there have been headlines about the lack of availability of ICU beds in our state, and I'm at the largest hospital in our state, and that's exactly true. That we, on a minute-by-minute basis, are managing all of our beds, but certainly our intensive care unit beds, and not just from COVID. Mm-hmm. There are people who have a lot of different medical problems, whether it's after surgery or after trauma or things like heart attacks and et cetera. And we are really stretched thin in trying to manage what has happened trying to manage all of that. And we're doing that in the context of a very tired healthcare workforce and healthcare system. So I'm sorry, that was a very long answer to your question as to what's going on, but I was hoping that sort of 40,000 foot view could help drive our conversation as we move forward.
Absolutely. No, your synopsis was definitely well needed, well deserved, really, because like I said, there's been so much information that is being shared on a very frequent basis that I think a lot of people either have tuned out and are just not following and not up to date at all, or there's a state of anxiety because there's really not a lot of explanation behind some of the facts that are being thrown out. And so there's this feeling for a lot of people of either indifference or panic. And so understanding from someone like you who's boots on the ground, what's actually happening is really important for your perspective is really important for us to hear. And so I think it's really important to understand something that a lot of the things that you've said, but in particular, when you talk about the Delta variant and we talk about mutations in viruses, I think for a lot of people who don't have a science background, the understanding that this is a natural occurrence with any virus is very, very important to underline. Just like with the flu virus, there are many strains and there are mutations that happen with replication of viruses as a part of how they are able to survive, really.
Right.
And so this is no different with the COVID-19 virus, in that as for survival, right? So it's a battle against...
It's a living thing. It
exactly.
will survive. That's
exactly.
Right.
That it has to adapt, and it does that by developing mutations that have a survival value, and that is able to be transmitted from person to person, as you said. And the fact that we have not achieved a vaccination rate that we had anticipated when the vaccine came out, where we could have perhaps stopped this from even happening had we been able to stop the transmission. Of course, hindsight is 2020, and there, we can always sit here and debate and theorize. But fact is, we're not there yet, and we're a long way from there. I just looked it up while we were chatting, and in my state, the state that I live in Texas, we're at 46%. So we're definitely nowhere close to the numbers that we need here either. And as you say, the other things that happened before COVID haven't stopped happening. Hospitalizations for non-COVID reasons continue to happen because we have other things that are happening in our lives other than COVID. And the strain on the system, as you said, is definitely showing. And it's, to me, I think, quite frustrating, because I feel like we're having the same conversation we had 6 months ago when we were so hopeful because we had the vaccine. And the fact that we have something that we thought was going to be a panacea and instead, for various reasons, including people who are afraid or don't have access to the vaccine, is kind of holding us back is really disheartening, I guess. So with that segue, let's talk about the vaccine. Let's talk about what is available currently. There are a number of vaccines that have been made available, some more popular than others. And sorry, there's a lot of background noise. I wanted to wait a second. There are a lot of vaccines that have been made available in this country. And there are some that, such as AstraZeneca, which started out, which was, the rollout started and then stopped, and Johnson & Johnson vaccine that started and stopped, and now it's back underway. So let's talk about the different vaccines that are available and a little bit about the background behind each of those.
Sure. So currently in the United States, we have 3 vaccines that are available to us. 2 of them use the mRNA technology. So that's where a little program is inserted basically into the vaccine, and that teaches our body how to develop the proteins that are similar to the virus. And when that code is sort of given to us, to our body, and develops a protein, then our immune system reacts to that. And it's basically teaching our immune system, hey, if you ever see this again, attack. That's what our immune system does.
And I will just interject here to say that all of these practices for all of these vaccines have been around for a minimum of years, for decades. None of these vaccines have been made in a new way. These are all, I just want to say that, because there's a lot of, again, just to touch on the misinformation that this is an experimental vaccine and how it's administered, and that is false. So sorry to interrupt, but I just preface all of these vaccines you're about to discuss with us by saying that.
Absolutely. And the other thing that we need to emphasize, not only is it that they've been around, people talk about rush in terms of, even this particular vaccine, right? Like, even if the methodology was around, what about this particular vaccine? We touched upon this a little bit in our prior conversation, but for all vaccine development, what you need is you first have your early development, sort of phase 1, where you're testing to see whether it works in the lab. And then you go on to phase 2, and phase 2, where it's smaller studies testing to see whether or not you're getting the response in humans, so smaller amounts of people. And then phase 3 are our larger studies, usually thousands of people, where we look to see not only are we getting antibody response, but are we actually reducing disease. And then once we've completed those phase 3 studies, we go on to apply for FDA approval. What I want to emphasize is every single one of those steps was followed in this process for all of these vaccines. And the reason that they were able to be followed in such a short amount of time is related to I think, well, the one large thing is this is a global pandemic. And so the financial investment that was necessary to permit these companies to do these studies very quickly was there. So investment by governments all around the world to do that. So the financial comfort that companies had in testing a new product, done. Number two, you have to enroll a lot of people in these studies. So, like I mentioned, thousands and thousands of people have to be enrolled in studies in order for vaccine studies when we talk about effectiveness. Well, when you have a global pandemic, you have a lot of people at risk for the disease.
Yeah.
And so very quickly, we were able to enroll a lot of people in these studies, and we were able to check the effectiveness. And so the phase 3 studies, which were started by the summer of last year in 2020, we were able to see within even 6 months what their effectiveness of the vaccine was in preventing disease.
And safety. Sorry to interrupt.
And safety, absolutely.
By definition of the phase of the trial.
Absolutely.
Yeah.
Absolutely. And then And the one thing a constant refrain I hear is we don't know long-term effects. We don't know long-term effects. And I hear that. Okay, fine. That's fair. You're saying we don't know the long-term effects of this thing because, well, we haven't had long-term, right?
Yes. Yeah.
But when we talk about side effects of vaccine generally, we're not talking about long-term effects.
Mm-hmm.
We're generally talking about people who have reactions to administration.
Yes.
And we're talking about a time frame of within hours to up to 3 weeks after administration of vaccine when we talk about vaccine related side effects.
Mm-hmm.
And so in that setting, absolutely we have the safety data. Absolutely we have the comfort level that we would need in the setting of a global pandemic, in the setting of something that we know causes significant morbidity, so harm to us, and death, mortality, in terms of that profile. And I think how we can see that best reflected is in probably your hospital, probably in my hospital. Almost close, not 100% of physicians have taken this vaccine.
Yeah.
So people who know the science, see the patients, do the work, spend the hours and do all of that, have taken this vaccine.
And if we're going to turn into zombies, the world is in big trouble.
Exactly.
The world is in big trouble because all your doctors are going to be zombies.
All of your doctors are going to be zombies, or transmitting 5G or whatever and you know what? We said, give it to us. Like,
yes.
Take that.
Yes.
We can inject it into our eyeballs.
Shoot it in our veins.
Exactly. So it truly is. I understand. I understand the concern and the hesitancy, but the one thing I will emphasize, whether it's your original question about the Pfizer, which is now an FDA approved,
yes.
as of 4 days ago, fully FDA approved, yes. vaccine.
For those who've been saying that they were worried because it wasn't, it was just a matter of semantics. It was just a matter of red tape, really.
That's right. And so that bureaucratic hurdle so if that was your true objective, you now have a fully FDA approved vaccine that you can get administered probably right now if you would like. And then the Moderna vaccine, which is also an mRNA vaccine, which I think is fairly soon to be fully FDA approved. Yes. And then the Johnson & Johnson, which will also likely be approved as well. The caveat for the Johnson & Johnson, which is a fine vaccine, if that's the one you get, we're seeing less effectiveness, particularly among the Delta variant for this vaccine versus the mRNA vaccines, which was also true with the original strains of the virus as well. So yes. If somebody asks me and they say, tell me which vaccine would you get? I would say, get the one that you are definitely going to get, right? Like whichever one you want, just get it. But if you were truly going to ask me a preference, I would do the 2-dose. But if someone says, look, I can't do 2 shots, I'm not going to do it, or I'm sitting somewhere where they can administer the Johnson & Johnson right now, the state of the pandemic right now is, I would say, barring and other considerations, if you have a history, the big issues with regards to history of clots, or in that setting, that it would still be okay to get it. But if you have a preference, you're sitting there and they're being offered to you, then I would get either the Pfizer or the Moderna.
Okay. And I do want to talk about the effectiveness, because that is another question that people have. A lot of people have questions about. But before we do that, we do need to take a quick break here. So we'll be back. You're watching What's Up Doc on Muslim Network TV, and we'll be back after this short break.
A free online chat can give you the personalized tips you need to start boosting your retirement savings today.
There are 16 million children struggling with hunger in America. That's 1 in 5 daughters, sons, neighbors, and classmates who don't know where their next meal is coming from. Yet billions of pounds of good food go to waste every year. It's time we do something about it. Feeding America is a nationwide network of food banks that helps provide meals to millions of kids and families in need. Visit feedingamerica.org to help them feed even more. Together, we can solve hunger. Together, we're feeding America.
When times get dark, we can't see the help that's all around us. Let 211 be your guiding light for help with food, healthcare, and other resources.
211, how can I help you?
Call 211 or visit 211.org. 211, get connected, get help.
Right here, baby. Look. Uma.
Something more than a birthday is happening here. Once you can see it, you can help. The sooner you recognize the signs of autism, the sooner you can make a lifetime of difference for your child. Start by answering a few simple questions at screenforautism.org.
Assalamu alaikum and welcome back to What's Up Doc. Today we have a really exciting show, and we've been talking about updates within the COVID-19 pandemic. And joining us in that discussion is Dr. Rana. Before the break, Dr. Rana, we were starting to talk about the vaccines that are currently available. And as you outlined, here in the United States, there are 3 currently available: the Pfizer and the Moderna, which are 2 shots, and then the Johnson & Johnson, which is the 1 shot. And you shared with us that the Johnson & Johnson is not as effective even before the variant, Delta variant, as the Pfizer and Moderna. And let's talk a little bit about what that means. I know we touched a little bit about that on our last episode, but now that we seem to know a little bit more, let's readdress that for a lot of people. And specifically, I've had people say to me, what does that mean? Break that down for us. And so in terms of protection for an individual, and I think especially now that we're seeing breakthrough infections and people who are fully vaccinated, right? Because we're touting these very high numbers for effectiveness and efficacy. And now that things are in play in patients are having breakthrough infections, there are the doubters who are saying, well, how useful is this vaccine if I'm going to get sick anyway? So I want to touch on all of, I know those are really actually nuanced different points, but I do want to touch on all of those for people who are still kind of anti-vaccine for those reasons.
Yeah, no, it's a great point. And I should probably even couch my comment with regard to the Johnson & Johnson vaccine for the earlier strains. It was less effective in terms of preventing any infection.
Okay.
But when we look at serious infection and death, it is still extremely effective. So
And when we talk about this, I just sorry to interrupt, but when we talk about effectiveness, we're comparing it to nothing. Just
nothing.
Yeah. Just for people's reference, like what's a reference point? We're saying as compared to someone who is unvaccinated.
Unvaccinated. Yeah, that's right. And the purpose of vaccines, again, because we do hear that, like I still got infected or I still. The purpose of the vaccine is not to prevent any infection. The purpose of the vaccine is to prevent you from getting seriously ill or hospitalized, or of course, the worst outcome, to die from this illness. And all three of the vaccines have continued to do an excellent job in that aspect. So even with the Delta variant, with these skyrocketing cases that we're seeing in this country and around the world, who we're really talking about when we talk about who's getting hospitalized and who's continuing to die, we're talking about the unvaccinated population. Now, are vaccinated individuals testing positive for COVID? Yes, absolutely. They are. We are having these breakthrough cases. There might be a number of reasons for that. It might be related to either the particular vaccine's effectiveness against this variant. It might be due to the fact that the people who have gotten the vaccine much earlier. So if you got the vaccine potentially more than 6 months ago, do we have what we call waning immunity? So the antibodies have sort of dropped down. But in all of those cases, of these breakthrough cases in vaccinated populations, we're still talking generally about mild cases. So people who have sort of cold or upper respiratory infection symptoms. There's still a concern with regards to transmission of mild disease, but we're still, when we talk about the vaccine effectiveness, if it causes you to have a sniffle and a sneeze and a little bit of feeling unwell, that's still a success for us. What our success is, or our concern is, did it make you have to be hospitalized, be in an ICU, and on the ventilator? And when we look at the data nationwide of all of the people, even in breakthrough cases, who have of all of the cases, even in breakthrough cases, the vaccinated population still make up a very small portion of that group. And then when you look at hospitalized cases, or you look at those in the ICU, or those who are on ventilators, less than 10% of that population is, and in some cases, even less than 5% of the population falls into those most severe categories when you're talking about vaccinated. And then I'll add an even additional nuance just to get into the nitty gritty beyond the headline of when we talk about the vaccinated population who is being hospitalized, who are making it to the ICU, who are getting on the ventilator. We are talking about often our most vulnerable population. So we're talking about elderly who don't have as much of a robust immune response to vaccines of any stripe, not just COVID vaccine. And we're also talking in general about usually people who have other immunocompromising conditions. So whether they get chemotherapy because they have cancer, or they've had transplant, or other medical conditions for which they have to take medications that weaken their immune system. So we're still talking about in the vaccinated population who are getting severe disease, people who are at risk, and the people for whom we desperately need to get herd immunity because they may not have as effective a response. It's part of that. And how I know that is in the fourth wave of this pandemic. So when we have rampant Delta variant cases, there are populations that are highly vaccinated where you have not seen the same rise in hospitalizations and the same rise in deaths. So in the United Kingdom, for example, they displayed a chart recently which compared the peaks.
We can pull that up right now.
Yeah, that'd be great. Where they looked at the current wave, which is the Delta variant. And as you can see, their peak in January, so this is a chart that has their cases, admissions, and deaths. And as you can see, with their peak in January, this overlapped. The number of cases and the number of admissions and the number of deaths were almost exactly, overlapping.
Yes.
And so that's like, that was their peak. When you compare the cases now in July through August, as you can see, the blue line is the number of cases. So as a proportion of the peak in January, still really high, like very high number of cases. But now go down to the bottom, the yellow line, which is the admissions to hospitals, and then the purple line, death. So while we would love those lines to be absolutely flat, we're not talking about a area that has, 100% immunity, but certainly higher herd immunity than we do. And this is what the vaccines clearly have done. So when you look at what happened in January and when you look at what happened in July, to me, I cannot see a clearer defense and support and sort of charge for vaccination than this, because this is what the vaccines are meant to do.
So do we know, Dr. Rana, sorry to interrupt, but do we know what was the percentage of immunity that was achieved in that subset of population that was studied?
So in the UK, about 60% of the overall population has been vaccinated. It actually might be higher by now, but at the beginning of the fourth wave, it was closer to 60% over.
Higher than your state and mine.
And mine, yes, that's exactly right. That's exactly right. And that was nationwide. And they also had higher rates of vaccination in their elderly population, which is also, again, continues to be a high risk population even after their vaccinations.
Amazing. Two things I want us to touch on based off of what you shared with us. One is let's talk about, when we talk about vulnerable populations, two other populations that are also vulnerable are our children and our pregnant women. And there's been a lot of information now in the news, and especially since the vaccines have been approved for children 12 years and older. We're still working, and I think past the fall, they're expecting to be able to approve it for children over the age of 5. But for now, for a lot of, and then when it comes to pregnant women, there's still this great hesitancy. I have people reach out to me pretty frequently asking me about both that they're currently pregnant and they're still debating whether they should take this vaccine, and women who are still concerned about the possibility for the effect of this vaccine on their fertility. And I know, again, we talked about specifically with the pregnant women because that was still an indication for vaccination back in January when we spoke. But with the children, that is a new thing that came out last month, I believe, or the month before. So let's touch a little bit upon that with our, again, two other vulnerable populations.
No, absolutely. So I'll talk first about the pregnant women. So as I alluded to earlier, this is currently a perfect storm in terms of increase in hospitalizations among the unvaccinated. And again, unfortunately, pregnant women or reproductive age women, as you alluded to, have had sort of higher hesitancy rates in terms of getting the vaccination. And the reason I know that is because in our hospital and in hospitals around the country, the highest number of pregnant women admitted to the hospital due to COVID-19 is being experienced right now. So in my ICU, our medical director for our ICU has even put out a statement saying he has never had this many pregnant women in his intensive care unit since he became a ICU director. So not just since the pandemic started, he's talking about ever, because when we talk about pregnant women, we're generally talking about young, healthy, reproductive, capable women, right?
Yes.
And so this is not the population that ends up in a medical intensive care unit. But since this is a population that hasn't been vaccinated, and we are now in a state where there's no restrictions, people are unmasked, people are going about their business, then we are now proportionately seeing a skyrocketing rate of infections in pregnant women. We have had deaths of young pregnant women. We have had women who have lost, lost their pregnancies after their admission, and there's no hesitancy in our minds at all with regards to the safety of this vaccine compared to the consequences that we're currently now seeing in the hospital. So the American College of Obstetrics and Gynecologists, of course, the CDC has put out strong recommendations for all pregnant women or women who are capable of becoming pregnant or thinking about becoming pregnant to please get the vaccine.
Yes.
And to really emphasize to our obstetricians to just like we give the tetanus vaccine during pregnancy, we give the flu vaccine during pregnancy. So this is really tragic. I mean, all deaths, all certainly are heartbreaking to us that we see in the hospital. But the seeing a young mom lose her child, and then or seeing a family lose their daughter in this setting. I mean, it's really been heartbreaking. Absolutely, because it's completely preventable. So that's one thing I'm going to emphasize. I'll just say it again, please, all women, everybody get the vaccine, but if you're pregnant, contact me, call Dr. Al-Barwani if you have any questions, but we are really pleading with you all to get vaccinated.
I 100% stand behind that. I completely agree with you. I think that for a lot of people, what they're not understanding or what they may not realize is that when we are making these recommendations, we are looking at risk benefit, just like you said, and the risk to yourself and your unborn child is very, very high should you get COVID. And I have people who never thought they would get it, who are taking full precautions and still get COVID, because you can never tell. You cannot look at someone just because you know someone that they could not be transmitting COVID to you unknowingly. And so it's really, really important, especially when you're in a high risk state such as pregnancy, to go ahead, as Dr. Rana said, and get vaccinated. And then with respect to children, I guess was maybe the next thing that you were going to touch on, because that is another vulnerable population. A lot of parents are very concerned. I know here in Texas, our governor, unfortunately, has decided to go out of his way to sign into law that there cannot be any mask mandate. So he has banned mask mandates and he has banned vaccine mandates. So that has made it very tough for a lot of public schools, of course, to mandate children who, again, there's vaccine hesitancy in adults and even more so in our children because of similar reasons to what we have talked about here today. And so it's a very delicate situation. And a lot of schools that have reopened this for the school year have had to shut down or go to virtual again very soon after opening, because it's very hard to keep children apart. And if they're not masked and not vaccinated, there are going to be problems. I mean, I think it's obvious, and I'm not in the school education system, and I don't have children, but I think it's very obvious. And for the policymakers and the people who are making these decisions, it's a very tough situation.
I completely agree. And so just to emphasize again, the cases and the serious cases we are seeing are primarily, it's a disease of the unvaccinated. And so as you said, under 12 are not capable of being vaccinated, barring the very few who probably participated in some studies. So as schools have opened, just as you said, all around the country in places without mask mandates, that's exactly what we've seen. And so similarly, the higher number proportionately compared to what we saw previously, because children are unvaccinated, yes, we are seeing higher number of kids in the hospital, a higher number of kids in the ICU. Now, it doesn't mean, we're not saying that the Delta variant is worse in the children or Delta variant is more aggressive. We don't know the answer to that question. I think what's a simpler sort of epidemiologic statistical answer is, again, these are unvaccinated compared to what we had previously. This is an unvaccinated population. And some of the mandates that were in place to protect them previously are no longer in place. So that's unfortunate, of course, about Texas. I know that was also the case in Florida, although apparently today just ruled unconstitutional, which hopefully will soon happen in Texas. But to me, it's just tragic because it's just a simple thing that can be done. I have friends who have children with type 1 diabetes. I have friends who have children with asthma who have to take chronic steroids. And it's just, to me, it's heartbreaking to know that there's a simple preventable thing that can be done, with the mask, at least until the vaccine is available for their age group, that could make the difference. And we're not seeing that uniformly practiced around the country for our children. And I don't understand, but we definitely are seeing higher rates of hospitalizations in children as well, and then higher rates of intensive care than we have any time in the pandemic. But like I said, I think it to me right now, as far as we know, it seems to be more of a perfect storm. Still investigating whether it's related to something specific to the Delta variant.
Okay. And before we go on our next break, I just want to touch on, with the two populations that we mentioned, our pregnant women and our children, is there a preference to which vaccine they should be choosing, or does your earlier statement, whatever is available to you at the time, stand? Okay.
Yeah, I think for children right now, so for the 12 and up currently, the 12 to 17, I guess, population, Pfizer is still the only one available for that population, and hopefully Moderna soon. And then for pregnant women, we were initially thinking about using the one-time Johnson & Johnson. And then there's these issues of potential clots in sort of younger reproductive age women as well. I have to say, while that concern is there, it's still extremely rare, extremely rare. So I would ask women to have conversations with their obstetricians, but I think still say, have the conversation and then choose which one is best, what you think is you and your doctor think are best for you. But I don't hesitate to recommend the mRNA vaccines to our pregnant women as well. I'll just, in terms of side effects, I had this conversation with one of my patients in clinic last week who told me I had convinced him to get the vaccine, but then he hadn't gotten it. And I was like, well, I clearly did not convince you. But what he said to me was that he had heard that somebody had died from the vaccine. And of course, I don't know what that means, right? And he probably doesn't know what that means, but that's what he had heard. He had heard that somebody died from the vaccine. And so the closest I can do in terms of analogy for that is I talk about seatbelts, right? And I asked him, every time he gets in the car, does he put on a seatbelt? And he said, yes, of course. Like, that's what you do. You have to put on your seatbelt. And I said, do you think that how many people put on seatbelts every day in this country? And, of course, millions and millions of people put on seatbelts every day in this country. And I was like, and how many accidents occur? Does a seatbelt prevent you from getting harmed in every accident? Well, of course it doesn't, because there's different types of accidents, and it can, you might still get hurt. Of course you might still get hurt, but would you have gotten harmed more if you weren't wearing your seatbelt? Well, yeah, of course, I probably would, get thrown out of the car. But in terms of preventing serious injury, do seatbelts do a pretty good job? Yeah, well, they do a good job. Okay, so would you not wear a seatbelt because you're not going to be completely saved by it? And so he looked at me and he was like, well, yeah, I'm still going to wear my seatbelt. Okay, great. Have you ever heard of a case? Have you ever heard of an accident where potentially, in all of the times that people have worn seatbelts, in all of the times people have had an accident, that the seatbelt pinned them in, or there was a malfunction of the seatbelt that somehow harmed the person that was wearing the seatbelt? That was unintentional. It wasn't meant to happen. It was one of those things that happens. Have you heard of that? And he said, yes, he'd heard of that. And I was like, is it very common? No. But has it happened?
Mm-hmm.
Yes. Are you still going to wear your seatbelt? Right? And so when we talk about even these vaccines, we're talking about over 4 billion doses have been administered.
Mm-hmm.
4 billion doses with a B.
Yes.
Are we going to hear some things?
Yes.
I think we are. Otherwise, somebody's not telling the truth.
I agree. That would be very suspicious if we heard nothing. Yes.
Of course. But I think we need to have a reality check here. And people are expecting things that are not realistic, and they're thinking, and they're not doing educated risk benefit analysis, which is hard, which is very hard, even for those of us with information to do, but so to me, that was the simplest analogy to think about. Like, we make a decision every day to save ourselves, even though we know that, it's not a guarantee.
Yes.
That's all we're asking for the vaccine too.
I completely agree. And of course, I'm smiling because as I was driving to work, I think it was yesterday, that same analogy came to me. And I think it's really, really cool that you brought it up and that you had that conversation with your patient. So we're going to have to definitely take a break, which is long overdue. I'm sorry, but we've had such an interesting conversation today. We're going to take this quick break here and we'll be back. You are watching What's Up Doc and Muslim Network TV. Stay tuned.
A free 3-minute online chat can give you the personalized tips you need to start boosting your retirement savings today.
Dad, they took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3.
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
I am what hunger looks like in America. I am an 8-year-old girl who's not excited for the last day of school. Because this may be the last time I'll have lunch.
Till September.
I am a single father of 2 who works 3 part-time jobs, and that's still not enough to put food on the table. I was created by artificial intelligence from faces of the 1 in 8 Americans who struggle with hunger.
Feeding America, 200 food banks strong.
Assalamu alaikum and welcome back to What's Up Doc. Today's really exciting episode has been on COVID-19 and getting updates on what's been happening in this pandemic. Joining us today is Dr. Rana. She is a returning guest, and we've been talking about, before the break at least, we were talking about a beautiful analogy as to how useful the vaccine is and how it's really helpful in preventing serious complications and death in majority of the cases of people who have been vaccinated. Now, we have spent a lot of time in this episode kind of breaking a lot of the terms and a lot of the updates with the pandemic. Before we wrap up, I want to talk about the booster because that has been the latest development so far. And a lot of people are asking about the booster because we don't necessarily need boosters for a lot of vaccines, such as our childhood vaccines. Some of them do require a booster, such as the tetanus vaccine, the flu shot, but not all. And for people who are already vaccine hesitant with the COVID-19 vaccine, this is another layer of, well, you see, you need a booster anyway, so what was the point of getting vaccinated in the first place? So let's touch on that because there are different layers to those statements that I just made as far as the booster. Let's start with why we even need the booster and who needs the booster.
Yeah, no, great question. So right now, I think the question is who absolutely needs the booster and who has been approved to get the booster. And so that population is categorized under what we would call the immunocompromised population. So these are people, again, who have either medical conditions or are taking medications that make their immune system very weak. And because of that, their initial response to the vaccine, the 2 doses of the vaccine that they received, is not as strong or robust. And so for that reason, it is recommended and it is approved already for them to go ahead and get a booster. And again, that has more to do with the fact that their body did not mount the same response to the vaccine in terms of providing protection that somebody who has a normal immune system would have. And so that is a population certainly that needs to receive a booster. What's in the news and headlines now is everybody else. So somebody who got the vaccine in January, February, March, and now, do we need the vaccine? And I know everybody hates nuance. Everyone wants yes, no, and I have to tell you, it's complicated.
Yes.
And the answer is not clear cut, even to this day. Now, our national board, ACIP, on immunization practices, is going to answer this question or review the data on the need for the booster in just a few days, actually, I believe on Monday and Tuesday, so the 30th and the 31st. And this is for, again, the non-immunocompromised population that's already received the vaccine. Okay. People are talking about, we need to prevent breakthrough infections. We need to prevent, we know that these are happening, particularly in healthcare workers. And the thing is that there are a lot of pieces to that equation. So people are saying we should give it to the healthcare workers, even if they have breakthrough infections that are mild, because when they have breakthrough infections, it still takes them away from the healthcare workforce, and we're really overly taxed in our need. So anything we can do to prevent that would be good. Other folks say, well, breakthrough infections are still transmissions, and so potentially we would need to get a booster, because if we have waning immunity, then we should also prevent transmission. Other folks say, well, wait, let's see who's actually having these breakthrough transmissions. Is it young, healthy people, or is it people over the age of 65? Is it healthcare workers who are having a lot of exposure, so they're having that? Or is it, for example, parents of children or other unvaccinated populations?
Yeah.
So those are the nuances that we don't know the answers to, that unfortunately, I don't think we're going to know the answers to on August 30th and 31st either. I think executive decision is going to be made. This is what my take home from that is going to be. I have no hesitancy with regards to the safety of a booster. I have no hesitancy with regards to somebody saying, I'm going to go get a booster. Is there going to be any harm for me to getting it right now?
Okay.
That I have no qualms about.
Okay.
When people ask me, is this what I need to 100% prevent me from getting, a breakthrough infection, number one, or number two, do I even really need it? We don't know the answer to that question. We will not,
Yes.
So I apologize for the nuance of the response, but I will say that whatever the guidelines come out in terms of recommendation, and then I'll add another element, we're so privileged here in this country. We have access to these vaccines. Anybody who wants the vaccine and is in the appropriate age group and doesn't have serious, history of anaphylactic or surge reaction can get the vaccine tomorrow, right? Globally, that's not the case. And so here we are potentially trying to prevent breakthrough infections or mild infections in this country, where while there are countries around the world where people who are extremely vulnerable, including healthcare workers, including immunocompromised populations, that haven't even gotten their first dose.
Yes.
So that to me is the additional nuance beyond, the other thing. But for me, but I will again emphasize in terms of take home, I don't have any hesitancy with regards to safety. I have more hesitancy with regards to, efficacy. So, or is it really needed? So that's what I'm trying to say. I mean, of course, people will snatch it and say, oh, it's not effective. And I'm like, no, this is data. And I always have to remind myself, like, I'm an infectious disease physician. I feel very comfortable in not knowing things, and knowing that there's so much to know, and excitement in that there's so much to know and so much to learn. Yes. And that what I say today, or the decisions I make today, or the recommendations I make today will change based on new knowledge tomorrow.
Exactly.
And that's a good thing.
Exactly. I completely
knowledge
agree.
And changing what we do. What else are you supposed to do? So,
I completely agree with you. I think that that's a really, really important point that you're making, because what I'm hearing is that you are giving us information based off of real science, real data that is out there. And if there isn't, or it's still out, the jury's still out on it, I want to know that. I don't want to be placated. I want to know, okay, we don't know for sure. It's a conversation that is being had, because should things change in the future, if we are at an absolute and things change, that'll cause more confusion and more hesitancy and more problems. So I appreciate that you are being completely honest with us about what is out there. And before we wrap up, I know we have gone way over. This is another long episode, but there's just so much to discuss, and I am okay with that. But when it comes to the booster, if I've had the Pfizer vaccine or the Moderna or the Johnson & Johnson for the booster, does it have, as far as what is out there now, does it have to be the same, or can you mix and match?
So again, we don't know yet what the recommendation will be for non-immunocompromised hosts. For the immunocompromised hosts, they are recommending that you get the same at this point. But again, that's because we don't think their initial response was enough. So we're trying to boost their initial response. I don't know what the final recommendation is going to be from the ACIP with regards to mixing. Right now, I think there are some healthcare systems that are providing boosters for their healthcare workers already, and they are generally giving the same one. There are studies underway currently, as of right now, looking at mixing the vaccines to see if there's a difference. We have seen some data. It's not available here, but there has been data from Spain on initial use of AstraZeneca vaccine, so an adenovirus-based vaccine, and then followed by an mRNA vaccine, that showed an actual more robust immune response than the getting 2 doses of the mRNA. Now that's not an option for us here, but so that's being studied. So we don't know yet. We will have recommendations probably sometime next week if they approve the boosters or the recommendations for non-immunocompromised. So we'll see. I have not seen clear data yet showing the benefit of having that, but I also haven't seen data of any harm in doing it either. There's no reason to think that if you got one versus the other that it would be, it's a safety issue. But the question is like, if there's a strategy that is more effective, of course we would want to do the more effective strategy, certainly.
Exactly. So definitely more to come. And I already can see a third part where we do yet another update as things continue. We continue to learn and find more information out throughout this pandemic. Thank you so much for your time, Dr. Rana. It's been a pleasure speaking to you, and we really appreciate everything that you've shared with us today, and we wish you every success.
Thank you so much. It's really been a pleasure. Thank you for having me and inviting me to speak on this topic. I just want to close, with please, everyone, get your vaccinations. If you have any questions, you can certainly reach out to me, rana@uab.edu. I'm on Twitter @AadiaMD. And I would, at this point in our pandemic, mask up, mask indoors, avoid large crowds. We're kind of a little bit back to where we didn't want to be. And honestly, Dr. Al-Barwani, I really want our next topic to be the pandemic is over. About,
yes, inshallah.
Inshallah. That's what I really hope our next topic, but I'm happy to come back for anything. Absolutely.
Well, we really appreciate you, Dr. Rana. Take care. Thank you, everyone, for joining us in another episode of What's Up, Doc. You can watch this and our other episodes on our website at muslimnetwork.tv and on our YouTube page at youtube.com/Muslim Network TV. I'm your host, Dr. Aalia Al-Barwani, and I'll see you next time on another episode of What's Up, Doc.